Hello, my name is Dr. Brenda Coughlin, and I have had the privilege of leading the Great Lakes Bay Health Centers as President and Chief Executive Officer for the past 8 years. But my first experience with Great Lakes Bay Health Centers was as a family medicine resident working with our migrant patients for 2 years and delivering babies for migrant farm workers in the 90s. Then I worked as a staff physician at Jane Street and soon became the medical director, a position which I held for 13 years before our board of directors selected me as CEO in 2012, but I still see patients. It is important that you understand the depth of need some of our patients face and what we can do to help them. I have been on house calls in homes with dirt floors in Saginaw. I had a patient trying to heal with an open wound on a farm with no running water. I served as labor coach for a 13-year-old when we delivered her baby without her mother, who was absent because of a drug problem. Her grandmother and aunt were there, but sitting 15 feet across the room. And all of this need was before the pandemic. My passion comes from advocating for people who can't find help or hope for themselves, or whom no one will listen to. Thank you for joining us to change lives by building hope in our communities during a time that feels very hopeless for a lot of people. I want to thank all of our Giving Hope Society donors and other donors for your support, which has allowed us to continue to be a beacon of hope in our communities throughout the coronavirus pandemic. Travel back with me in your mind to Friday, March 13th. I was driving to the Bishop's Breakfast in Saginaw when I heard on the radio that schools were closing due to the coronavirus pandemic. It was clear to me at that moment that my training as a family physician with a Master in Public Health and Great Lakes Bay Health Center's role in our community put us in a position to be a shining light of hope for our communities during a very difficult and scary time. Now, 8 months later, we can continue to bring hope to hopeless people in our communities with your help. Recently, the COVID-19 case numbers for Michigan have increased significantly. The state health department has issued more restrictions, and we are seeing hundreds more people every day at our testing sites, with over 10% of those tested testing positive. The lines are long, and the demand is growing. We are more concerned about having adequate supplies and meeting the health needs of our neighborhoods. We are doing more, and much of our extra work is not reimbursed. How in the world can anyone come before you today and say we are hopeful? Very honestly, we are stronger than we were in early 2020. We are better prepared, having been through these past 8 months. We have learned to be more flexible and have stepped up to these challenges. We are confident that you, our donors, will rise to meet these challenges with us. Great Lakes Bay Health Centers provide quality health care for everyone seeking our services in a 16-county area of the Great Lakes Bay region and beyond, regardless of insurance coverage, through touching lives, healing people, and building community together. After 50 years in business, we met the challenge to pivot and perform in new and often better ways to service the healthcare needs of our community through this pandemic. What did not change is our culture of identifying our community needs and delivering hope to the needy. Coronavirus has changed the needs of our community. It is an invisible enemy, creating a lot of fear, anxiety, isolation, illness, and death. During April and May this year, we touched lives by providing emergency or urgent dental visits to nearly 4,000 people when other dental offices were closed. We helped heal people during the COVID pandemic by running medications from our pharmacies to patients in their cars who needed to stay isolated and delivering medications to patients' homes. When we had to temporarily shut down some in-person services, we transitioned to offering telehealth visits within 10 days of the shutdown starting. This helped us to bring hope to many people who were feeling very isolated and scared and just needed to talk to someone. To reach out to people who were paralyzed by the fear of being diagnosed with coronavirus in the emergency room and then sent home. To bring comfort to those who were feeling very threatened by racial unrest. We provided cell phones in our parking lots for those who could not access a telehealth visit with their technology at home. Doctors evaluated sick patients in their cars. A provider took a patient food when they didn't have enough, and we all listened on the phone when patients were afraid and needed to talk. We helped people through traumatic stress that they experienced from fear of disease, fear of dying, and fear of violence. At times, we cried with our patients. We helped build community when we opened 3 coronavirus testing centers to identify those who have the virus so they can prevent spreading it to others. We are proud to have provided more than 25,000 tests and are working to renovate buildings and hire staff to continue testing through the winter and beyond. When we opened our testing centers, we did not have funding, and we had no way to be reimbursed for the costs of collecting the tests. Staff were afraid, and we didn't know how the virus was spread. But we have dedicated staff who have volunteered to run our testing centers, and today we provide hundreds of tests daily without having to charge any individual through partnerships that we have developed. We can now give our communities the hope of keeping their families safe and slowing the spread of coronavirus. My vision for the future is that we can continue to support our communities through this pandemic by providing readily available testing to allow early detection of coronavirus and minimize spread, and by providing excellent, coordinated services through a combination of in-person visits, telehealth, delivery options, and drive-through services such as flu and COVID immunizations, testing, and treatment to keep people safe. We need to expand our behavioral health services. Most of us are struggling at some level with COVID fatigue. Sometimes our coping mechanisms are not enough to deal with all of the pressure, frustrations, and disappointments, and we need someone to help. I want Great Lakes Bay Health Centers to be able to provide counseling, medication management, care management, and community health worker services to help people who have no housing, can't feed their children, pay their electric bill, or find a job. All of these services rely on partnerships and your donor support. In order to accomplish this vision in 2021 and beyond, we need tents, remodeled spaces for drive-through care, new technology for telehealth services, more staff for screening, testing, and running prescriptions to cars or delivering medications to homes. And of course, more personal protective equipment to keep all of the people who do this work every day safe. We need to hire more community health workers and counselors, purchase new software, and develop new spaces. We can bring real hope for the future to our community together. I appeal to each of you to join us today in making a difference in the health of our community. You, my friends, have not lost hope. Please donate today to share your good fortune and bring hope to the hopeless. Our goal of $100,000 is very reachable, but only with your help.